Diabetes mellitus. Diabetes is a metabolic disease that affects over 9% of the global population. Hyperglycemia is when there are high levels of glucose in the blood, and it is associated with diabetes. First, we will define type 1, type 2, and gestational diabetes. We will look at the risk factors and look at relevant diagnosis. In healthy individuals, when carbohydrates are ingested, the body will break them down into a substance called glucose. In response to increased glucose levels in the blood, beta cells of the pancreas will secrete insulin. Insulin will bind to receptors on target cells of tissues and organs, and this will open a channel, causing glucose to flow from the blood into the organ or tissue. Type 1 diabetes, insulin-dependent diabetes mellitus. In type 1, beta cells of the pancreas are destroyed by the immune system. Insulin production is reduced, and less insulin binds to the receptors on target cells. More glucose remains in the blood, and glucose is moved to the surrounding tissues at a much slower rate. Type 2 diabetes, non-insulin dependent diabetes mellitus. In type 2 diabetes, the body still produces insulin. However, something goes wrong with receptor binding or insulin signaling inside the cell. The cells are not responsive to insulin and glucose stays in the blood. In other words, type 2 diabetics are insulin resistant. Gestational diabetes is defined as any degree of glucose intolerance that occurs during pregnancy. Possible risk factors for diabetes. The etiology for type 1 diabetes is unknown, but genetic factors are believed to play a role. Possible risk factors for diabetes include physical inactivity, family history, obesity. Individuals with a body mass index greater than 25 have a greater risk of developing diabetes. Ethnicities that have higher instances of diabetes include African American, Hispanic, Native American, Asian, and Pacific Islander. Women who gave birth to a baby weighing over 9 pounds or had gestational diabetes during pregnancy are more likely to develop type 2 diabetes. 50% of women that have had gestational diabetes will develop type 2. Diabetes is associated with other conditions like polycystic ovarian syndrome or cardiovascular disease. Hypertension and depression are also linked to diabetes. Chronic sleep deprivation with less than 6 hours a night is also a risk factor. Therefore, maintaining a healthy mind and body through physical activity, proper sleep, and good nutrition is essential to prevention of this disease. Relevant diagnosis. When patients see their dental hygienist, it provides an opportunity to screen for undiagnosed diabetes. There are 3 main ways to screen for diabetes. Take time to review the patient's medical history, pay attention to potential risk factors of diabetes, and symptoms. There are many questionnaires like these that can help a patient identify symptoms and risk factors. When reviewing the patient's medical history, check for symptoms. Think of the 3 P's when checking for symptoms. Polyphagia, which is when the patient experiences excess hunger. Polydipsia means excess thirst, and polyuria refers to excess urination. If you are concerned that the patient may have diabetes, you can refer them to a physician for further diagnostic testing. Some dental practices do perform diagnostic tests as a preventative screening for patients who may be at risk. A sample can be obtained using a finger stick, or a sample of gingival bleeding may be used. The sample will be used to evaluate A1C, a measurement of the average blood glucose levels over the past 2 to 3 months. A patient with an A1C measurement of greater than 6.5% is an indication of diabetes. After the patient has fasted for 8 hours, fasted plasma glucose levels higher than 126 milligrams per deciliter is also an indication of diabetes.
Created using Powtoon.